Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theaters with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Good morning, everybody, and welcome to a new edition of the Hindu Wellness Webinar presented by Naruvi Hospitals. The theme of today's discussion is the importance of early dental care. Oral health is like a window to our overall health, and taking care of it is an investment in our overall well-being. We need to practice oral hygiene by maintaining healthy teeth, as it not only prevents dental disorders, such as tooth decay and gum disease, but also could protect us from some other diseases of the heart, the lungs, even eating disorders or rheumatoid arthritis, and different types of immune system disorders. To tell us more about it, over the next 1 hour, we will listen to our panelists who will share their knowledge and tips with us on how we can take care of our teeth. Please feel free to send in your queries once the question and answer box is opened. We have an interesting panel of doctors from Naruvi Hospital, Vellore, and I have the privilege of first introducing Dr. Surya Prakash Sharma, who is currently heading the dental department, an MDS with 11 years of experience behind him. Dr. Sharma specializes in prosthodontics and oral implantology. He worked as a senior consultant in Christian Medical College, Vellore for 8 years before joining Naruvi Hospitals in 2020. He has a fellowship in oral implantology from the International Congress of Oral Implantology, USA. Dr. Sharma practices general dentistry and has a special interest in smile designing, full mouth rehabilitation, dental implants, and TMJ disorders management. I would now request him to give his presentation on the importance of early dental care. So welcome, Dr. Sharma, and over to you. Dr. Sharma has to be unmuted.
Am I audible?
Yeah, yes, sir.
My screen is visible?
No, not yet. Yes, it is visible now, doctor.
So, good morning, one and all. I really salute each and everyone who is attending this webinar on this beautiful Sunday noon. Sunday is very important day in our life where we finish our unfinished work. Very important work like sleeping, eating, again sleeping, and again eating. So you guys have dedicated this important time slot for this webinar. I hope this webinar will give you some good take-home points regarding this importance of early dental care. I also want to thank the whole Hindu team, especially Mr. Pradeep and Mrs. Basu for conducting this webinar along with Naruvi management. So today's topic is the importance of early dental care. You would have seen a lot of hospitals, they have this comprehensive health package system where they cover all the diseases from head to toe. But if you see, if you notice very keenly, there will be a miss for a full dental examination or an oral health package. So there is a clear-cut negligence from the hospital side and from the doctor sides regarding the oral health. Very few hospitals in India and abroad, they have the dental examination included in the health packages. When it comes to the insurance, if we take a comprehensive health policy, they cover almost a list of 100 diseases. But if you go and ask them about the dental health care, there is no coverage for dental health care. So there is a big negligence from the insurance side also. Coming to the patient side, you would have seen many patients, they have long-term dental problems, but they don't go to the dentist at all. They just go to the pharmacy or a medical shop. They buy the over-the-counter medicines and take it without diagnosing the problem. And when the problem becomes big, then they report to the dentist. When we ask what happened, they said, "Sir, daat hi to hai, dekh lenge." This kind of attitude mostly runs regarding the oral health care. So the whole purpose of this webinar is to create awareness about the dental health and the dental problems, and to give you the importance of early dental care. So one of the main important advantage of early dental care is we can detect the problems at a very early stage. I'll give you one small example. You can see this. So you will be seeing a lot of these dental pictures and dental videos. This is not to scare you. This is just to give you an idea like what are the type of dental diseases and what can we do about it. So don't feel, disappointed by seeing all these pictures. So now in this picture, you can see a grossly decayed teeth, which the decade has extended almost half of the tooth. So do you think that this decade has reached this stage in a single day? No. Definitely, this tooth has given you multiple chances to save it, but due to negligence, it has reached this stage. So actually speaking, the cavity, the grossly decayed tooth, it starts with a small pinpoint caries like this. It is called early caries or incipient caries. So this is in very, very early stage. It is generally appears as a small brown spot or small black spot or a white spot, which could be a non-cavitated or a cavitated. So if you report to the dentist in this stage, it is very, very easily manageable. Mostly what happens is in this stage, the patient will not feel any pain because it is only involving the top surface of the tooth, that is enamel. But you can avoid this by going to dentist in a regular follow-up. Like for example, you go to a general physician every 6 months to check your blood sugars and your diabetes, hypertension, everything like that. Once in 6 months, it is advisable to visit your dentist, have a complete oral examination. So in this examination, if you find these small spots, it can be easily manageable. I'm not going to bore you with the detailed tooth anatomy, but for a layman perspective, that this is a tooth. Okay, the part which is visible in the oral cavity is called crown, and the one which is inside the gums and bone, it is called root. So the top layer is the enamel layer, which is the hardest part in the body, even harder than the bone. So imagine if the caries is only in the hardest portion, that is in the enamel, it is very easily manageable. When the caries progress to the second layer, which is called dentin, then the patient start experiencing the sensitivity to hot and cold footsteps or pain on biting. All the symptoms starts. When it reaches the pulp, it becomes more invasive. So as I told you, when the caries is in the top layer, it is easily manageable with the help of a sealant. So what we do is in a controlled environment, we isolate the tooth properly and then we put a sealant. And once we put the sealant, you can see that the whole dental decay, the tooth is covered with a protective layer. So this will stop further progression of caries. So this is one of the major advantage of early dental care. The second thing is the second problem which we can detect in very early stage is the gum diseases. So this center picture, you can see this is the example of healthy gums. The healthy gum will look like this. So if you want to take 1 point today, take home 1 point today, just notice that the gums need only one thing from you. It needs a healthy environment around it. It is the most OCD part in our body, If you have a food particles around it, the gums will become inflamed and they shy away from the tooth. So you can see this small redness. This is all inflammation. This is called gingivitis. Gingiva is nothing but gums. So this is happening because of this plaque and debris. So what happens is initially there will be a food debris. If it is not cleaned properly, then it becomes plaque within few hours. And when the plaque becomes calcified, it becomes calculus like this. Calculus is nothing but the hard, sticky substance. So definitely you need a professional cleaning. If you brush twice or thrice daily, also this calculus is not going to go. The food debris, you can clean it with your brushing, but this type of calculus and this plaque, it can be removed only with the help of a professional cleaning. You can consider gum disease is like a cholesterol in your body. So for example, for a heart disease, cholesterol is the basic problem. Once you have a cholesterol, then it becomes atherosclerosis, that becomes hypertension, that becomes ventricular hypertrophy, then it leads to heart disease. Same way, the gum disease is the first point. If you are brushing and you're finding there is a bleeding from the gums, that is the first sign. That will lead to gingivitis, then it will progress further and becomes periodontal disease and eventually loss of teeth. So definitely everyone needs professional cleaning. Even though you have well-aligned teeth, but once in a year or once in at least 6 months, depend on the condition, you need one professional cleaning from dentist. It is advisable to brush twice daily and floss at least 3 times a day. So this is just a simple example of how the disease progress. On the left side, you can see a healthy tooth, which is covered with healthy gums and bones. There is a good thick gingiva, which is holding the tooth. And these are the fibers which are holding the tooth properly and the bone. So when there is a food debris around the tooth, it causes inflammation. I just showed you in the picture, there is a redness, that is inflammation. And when the inflammation is not treated, it creates small pocket like this. Then you will have food impaction between your teeth. That will again induce this bone destruction and it goes to the advanced stage. Finally, this tooth will start mobile and within few years, the tooth will fall. So this is the whole sequence from food debris to plaque, calculus, pocket, and then finally you're losing your teeth. So do not wait until this stage. Please report here. So you can save your teeth. So this is an example. Periodontal is nothing. Peri means surrounding. Dental means the tooth. The gum fibers and bone which is surrounding the tooth, it is called periodontium. So this plaque and calculus is not cleaned properly. It is purely negligence from the patient side and it has progressed. So as I told you, the gum will shy away from the dirt, from the debris. So there is a gum recession and this tooth will start mobile. And finally, there will be a loss of teeth. Another problem which we can detect in a very early stage is pre-malignant oral lesion. I can surely tell you that there are more than 50 type of oral ulcers, which even very difficult to diagnose by general physician and dentist also. We need complete thorough examination. Sometimes we need biopsy to diagnose those ulcers. So kindly do not diagnose the ulcers at home. See, for example, in this picture, there is a small white spot. This is not giving any trouble to the patient. This is not causing any pain or burning sensation. But I'm telling you, this is a pre-malignant oral lesion. This is an oral leukoplakia. So kindly do not diagnose these ulcers at home. And the ulcers can be ranged from a simple aphthous ulcer to traumatic ulcer because of the sharp teeth. It could be because of nutritional deficiency, could be zinc deficiency, minerals or vitamins deficiency. It could be because of viral infection. It could be because of bacterial or oral candidiasis or fungal infection. It could be due to diabetes or any other systemic disease because of immunocompromised diseases, or it could be because of oral ulcers. So there is a vast diagnosis involved in this. So kindly do not, if you see these ulcers, kindly check with your dentist whether it is a normal ulcer or what type of ulcer. So for this regular dental checkup is very, very important. So this is one example of this oral cancer. So see, if you report to the dentist in a very early stage, we can actually limit the extent of oral cancer. We can treat early. We can do many things to stop this further progression. So this is one of the example of oral cancer. Another very important the problem which you can avoid is TMJ disorder. TMJ disorder is nothing but your dental joint. I request everyone to put your 2 fingers near in front of your ears and just open and close the mouth. You will feel a joint. This joint is called a temporomandibular joint. This is your dental joint, which helps in opening and closing the mouth, which helps in eating, speaking, swallowing, etc. So when you have inflammation around the joint, you will feel that there is a pain inside the ear. When the pain radiates to the head, you get this headache related to the dental issues. When the head goes to the maxilla, you have pain in the upper jaw. When the pain radiates to the lower jaw, you will feel difficulty in opening the mouth. You feel difficulty in eating hard food, etc. So few patients, when they open the mouth wider, when they yawn, they get pain. They experience pain in this joint. So bruxism and clenching. So I'll give you one small example. Morning, you're having breakfast around, you're taking 10 to 15 minutes, then lunch, then dinner. So if you see out of 24 hours, around 1.5 hours, your upper and lower teeth are touching each other when you're biting, when you're clenching, eating, swallowing. So overall, around 1.5 years, your upper and lower teeth are in contact. The other 20 to 22 hours, the teeth are not in contact. They are at rest. So this bruxism patient, what happened is during the night, they are unknowingly grinding their upper and lower teeth. Either they are clenching, which they are biting, or they are grinding, which is called night grinding, which is called bruxism. They're grinding. So what happened is around 8 to 9 hours, they are constantly grinding. Plus this 1.5 hours normal eating time. So overall around 10, 12 hours, they are grinding. So obviously the muscles and joints are overloaded. When they are overloaded, they become inflamed and they become sore. So these kind of problems we can actually treat at a very early stage with very, very simple treatment like oral physiotherapies, TMJ splints, etc. Another problem is we can detect in very early stages attrition, abrasion, and erosion. So attrition is nothing but your upper and lower teeth, they are grinding each other. So you can see this wear and tear in the chewing surface, which is called incisor or occlusal surface. So this is attrition. Abrasion is nothing but your teeth and some other object. For example, toothbrush. So when the toothbrush is rubbing against your teeth, it is causing wear and tear. When you are using hard toothbrush or the brushing technique is very wrong or very vigorous, then it causes wear and tear in this surface. This is called abrasion, which is tooth to other objects. The third type of wear and tear is called erosion, which is basically as acidic wear. So the acid comes from two. One is external source, the other is internal source. External source is your aerated soft drinks, alcohol, your acidic juices, or they have acidic like the lemon sucking habit or swishing the Coke or Pepsi, all this acid which is coming from the outside environment. The second source is coming from the inside, where you have GERD problem, like you have gastric esophageal reflux disease or acidity problem, where the acid coming from the inside. You may not sometimes feel burning sensation here, but the acid regurgitation itself is caused wear and tear on the inner surface of the teeth, which is on the palatal surface or the lingual surface. So these type of wear and tear we can treat very easily in the early stage. So the proper method of brushing, it is not horizontal always. It is the proper way of doing it is from for the upper teeth. You have to do it from top to bottom, and for the lower teeth you have to do from lower to up. So in the first picture you can see that the toothbrush angulation is from top to bottom, and for the lower teeth you can see it is from down to up. So the brushing technique matters. So as we discussed, the advantages is one, you can detect the problems in a very, very early stage. Second, prevention is the key. Prevention is better than the cure. So third thing, you preserve lot of tooth structures and gum structures. You can actually stopping the further progression of the diseases. The fourth main important point is cost. If you are reporting in a very early stage, the cost of dental treatment is very, very less. And finally, it is never too late to improve your spine. Thank you very much.
Thank you, Dr. Sharma, for those valuable inputs. And I'm sure we'll again come back to these points once more as a reiteration of the important message. Our next panelist is Dr. G.V. Sarvapalli, an orthodontist and dentofacial orthodopedist. He is a gold medalist from the Meenakshi Ammal Dental College, an Invisalign board certified and lingual board certified orthodontist. He's known among the top Invisalign providers in Vellore, predominantly using the latest Damon and Insignia system, and has completed close to 200 Damon cases. Dr. Sarvapalli's specialty is in treating complex and early orthodontic cases, and his interest lies in growth modulation, myofunctional, and interceptive growth orthodontics. He will now present his talk on interceptive orthodontics. So welcome to you, Dr. Sarvapalli, and we'll hear you now.
Hi, can you hear me?
Yes, sir.
Yeah. Hi, good day to everyone. Thank you for the introduction, Ms. Basu. The topic for today's discussion is interceptive orthodontics. So while most of us will be aware of what orthodontics is, let me explain it to you, those who don't, what is orthodontics.
So you're not audible.
Unmute.
Unmute yourself.
Can you hear me now?
Yeah, yes.
Yeah. So hi, good day to everyone. Thank you for the introduction, Ms. Basu. The topic for today's discussion is interceptive orthodontics. So while most of you are aware of what orthodontics is, let me explain it to you for those who don't know about it. Yes. So orthodontics addresses the diagnosis, prevention, management, and correction of malposition of teeth and jaws, as well as irregular bite patterns. And dentofacial orthopedics also deals with the modification of facial growth. So in general, orthodontics and dentofacial orthopedics is basically alignment of bones and teeth in the dental region. Unfortunately, the common misconception is that orthodontics involves only the alignment of teeth. Unlike teeth, the facial bones also demand an early intervention, as they can be corrected only during the growth phase. So let us see examples of how irregular growth patterns and how to deal with them. So we can examine the facial proportions using vertical and horizontal lines which are drawn in the face. So I assume you can see that these are known as the vertical thirds. So this picture here depicts how a well-proportioned face should look. The proportions, if they are not proper, then you will have either there will be an excess in the upper face or excess in the lower face, that is excess in the upper face or excess in the lower face, or it can be a short face or a nasal excess. So I'll just show you examples of how it will be. So this young man here is presented with an excessive lower facial height, whereas this lady here is presented with a reduced lower facial height. You can see the height of the face in both the individuals. One, there is an excess, one there is a short face. So they are beyond the growth age. So if they are addressed during the growth age, we could have actually corrected during their growth phase itself. So next is a frontal examination, in which another way to check your irregularities by checking your facial symmetry. Most of them have facial asymmetries, but if the deviation is less than 3%, it is permissible and not evident to our naked eyes. Any deviation that is beyond that will require intervention. So from the bite of the scale from this young lady, you can see there is a quite deviation in the lower jaw. You can see that the midline of the up, from the hairline to the nose and to that of the lower chin, if you could see, the upper two midlines are in coincident, whereas the chin is slightly out. So this is an early intervention which can be identified, and we can actually help in diagnosing and treating it at an early stage. So these are some examples of hereditary malocclusion, which is a deep bite case. The same individual if left untreated during his childhood, will end up in something like this. You could prominently see his chin is being seen, which is grown in a forward direction. If they had encountered during the early age, the growth could have been stopped and could have been diverted. So this is another similar scenario in which there is a deficient jaw. You can see this when he smiles, you can see only his lower lip is being out. You cannot appreciate the upper jaw being out. And in this female, you can see his lower jaw is completely out and the upper jaw is in normal position. So this resembles excessive lower jaw growth, and this resembles a reduced maxillary growth. That is your upper jaw growth. So we doctors, apart from visual examination, we also include X-rays and to confirm their initial diagnosis. This is done using cephalometric analysis. So this is an analysis in which whatever you guys have seen previously till now, with that correlation with the cephalometric examination as well as evaluation, we will come into a definitive diagnosis of how to treat these patients if they are at a very, very early age. So the most common tool for growth modulation is upper jaw or headgears. So there are types of headgears which can be used based upon the need for the patient. So it is not mandatory everyone will wear a headgear if they have something problem in the maxilla, that is in their upper jaw. There might be a difference in the wear of headgear, like it can be a high pull headgear, it can be a cervical pull, it can be a medium pull. It all depends upon what kind of movement we need to restrict the growth of the jaw. So this is a similar case in which you can see the vertical axis of this patient is slightly high in this scenario. This is the pre and post picture in which a small splint like this, which has been used along with an external appliance, which has been attached to it to intrude the maxilla. As you can see, the chin prominence and the smile both have been corrected with the help of by restricting the maxillary growth and slightly pushing it behind. Whereas the mandible has been allowed to grow, that is your lower jaw has been allowed to grow and is made to in a very, very good position. Similar to how upper jaw has been repositioned in the previous case, in this case, the lower jaw has been repositioned. The activator appliance has been used for this case. The before and after picture shows a significant correction of the lower jaw. The bite also has been corrected as seen in this pictures. So you can probably see here this chin and throat angle. So that is like from your throat to chin and to your upper lip, to your lower lip. The same thing, if you can see here, there's a lot of difference in the jaw position or jaw line. That's because his jaw was previously positioned in a very, very backward position. So with the help of this appliance at an early age, we were able to actually push the jaw in a front position, and after which you can do an orthodontic treatment to correct their significance. So another similar example is a face mask. So the previous one which we discussed was headgear, and this is something known as Delia's face mask. This is something like similar to a treatment like a headgear, but this allows an entirely pulling your upper jaw forward. That is to enhance your maxillary growth. So this is an appliance. It looks very, very scary, this appliance, but trust me, this appliance does wonders to a lot of patients because it is a life-changing appliance to a lot of those young kids who feel their face is something off. I'll just show you a picture so it will be much appreciable to what it is. So in this case, the face mask has helped to align the facial proportions of this young boy. You can see here this bone. We call it as the malar bone. You can see there's deficient malar bone in this region, and you can see a very good appreciable malar bone here. And you can see the entire jaw has been shifted. So this is something which is a wonder for the patient because the proportion of the face has been completely changed for him. So these are some other examples of how pre and post, a similar case in which how the jaw has been pushed forward. So usually treatment like these are a combination of both orthopedics and orthodontics. They go hand in hand. So that's what this entire thing is about. It's not in general itself, we can correct all the things at an early age. So to conclude our session, I would like to emphasize how essential it is to diagnose the abnormal growth patterns at a very early age. Apart from providing the child with a better visual presentation through modulation, these corrections also are very important for providing better functionalities to their jaw. I therefore insist to parents to visit an orthodontist is a must for every child at a very, very young age. Thank you.
Thank you, Dr. Sarvapalli, for those valuable slides. Our final and third speaker is Dr. Juhi Anand. She's a consultant in conservative dentistry and endodontics. Dr. Juhi completed her graduation in 2016 from KLE University, Belgaum in Karnataka with a gold medal in her BDS and pursued post-graduation in endodontist in 2017 from Hazaribagh College of Dental Sciences and Hospital in Ranchi, Jharkhand. She went on to be one of the university toppers and gold medalists in endodontics, where again she topped in her university. She is widely recognized for her work in Vellore and recently received an appreciation award for record number of root canal treatments in a year in Vellore in a single clinic. So Dr. Juhi's presentation is on dental caries and root canal treatment. The floor is yours, Dr. Juhi.
Thank you so much, ma'am, for the lovely words. Good morning, everyone. Good afternoon, actually. I'll be presenting today on caries and root canal treatment, which is one of the most common problems which we see these days. So what is dental caries? It is commonly known as decay or the cavities which you see in your teeth. It is one of the most common and widespread dental issue today. Although the caries are most common in children, because they have a weaker upper surface, which is called the enamel. As you can see here, this is a proper healthy tooth, which if there is caries, this results in a cavity or a decay, which when progressed further may lead to touching of the pulp. This is the nerve of your tooth. What are the signs and symptoms which you'll see in the caries? It may be the first thing most commonly which we see is tooth decay, a toothache, which you can see here, like it might be radiating pain or just in that area of your tooth. One is tooth sensitivity, which is to having hot and cold food whenever you have. One is most common, which is the hole in your teeth, discoloration or the dark spot. When it goes further, it may result in the facial swelling. As you can see, the right side of the face is more swollen as compared to the left side. Or as final, there might be pus collection, which is commonly known as the abscess. So the underlying thing is that what causes these cavities? Most commonly, we can see it might result from your sugary food, sugary drinks. Commonly, it might be from the acid reflux or the lack of enamel, the upper surface of the tooth, dry mouth, when there is less secretion of saliva in your mouth, then lack of brushing or lack of fluoride, which is one of the main causes. Most of the individuals, it may result in cavities because it helps in prevention of decay. So how to prevent these caries? Most important is dental hygiene, how you maintain your hygiene. The secondly, you can do the diet adjustment, avoiding the sugary drinks, as it may act as a substance for the bacteria for decay. Limit sticky food, because it's when there is sticky food, it's difficult to remove it from the tooth surface. Last is some of the dairy products which might be rich in calcium, like yogurt, all that. So what are the ways to prevent it? One is fluoride treatment. As said, fluoride is one of the most important things for maintaining a healthy cavity, a healthy tooth. Second is filling and restoration. As you can see here, you can easily restore your tooth to its original shape and size by getting a restoration done. Then is root canal treatment. If it is beyond the scope of just restoration, you can get a root canal treatment done and save your tooth. After a root canal treatment, you can get a crown done over the surface of your tooth so as to prevent it from any kind of fracture. Or else, if there is no option left and we cannot save your tooth, we'll have to go for an extraction. So what is a root canal treatment? And as commonly we see, people really dread getting a root canal treatment done. It is actually to eliminate all the infection and the bacteria which is infecting your root canal, or to prevent any type of reinfection of your tooth. When one undergoes a root canal, the inflamed or the infected pulp, which is your nerve, is removed, and inside the tooth is carefully cleaned and disinfected. As you can see here, this is an infected pulp tissue which gets inflamed and further causes abscess or any type of infection. We remove this complete part and then clean it and then fill it. I'll show you that in a video. In this video, like we can see, this is your tooth surface, which might result in a cavity and decay. After that, what we do, we clean the surface. This is the cleaning. After that, what we do, we put artificial biocompatible material and seal it completely. This is called a gutta parcha. Over that, we put a filling, and this is your root canal treatment. To prevent any kind of fracture and further decay, what we do is reduce the surface of your tooth and put a crown over it. And that's your root canal treatment. So you might be thinking, how much does a root canal treatment cost? This is the most common question that we get. It actually depends how complex your problem is. Molars, which are the posterior part of the tooth, which are mostly more affected because they are the first teeth to erupt in the oral cavity. Generally, the endodontic treatment, that is the root canal treatment and restoration, is less expensive than the alternative of having your tooth extracted. If you get your tooth extracted, what happens is there are various kind of problems that you may suffer from, and you need to get it replaced, which might be because with an implant done, which is the screw type, or you have to get a bridge done over there, which costs more than just getting a restoration or a root canal treatment done. As this, you would have seen this poster most commonly, dentistry is not expensive, neglect is. As further you delay your treatment, more expensive it gets. Some of the most common root canal treatment myths which we come across are these. You will be thinking that I'll get a root canal treatment done, it will definitely hurt me, right? No, that's not the cause. Most of the root canal these days are painless. You will not feel that because a block or an injection is given there. I can't have a root canal when I have an infection. That is completely wrong, because when you have an infection, as soon as you get a root canal done, that is the time when your infection will start subsiding and you will have less pain at that point of time. That is the only way to prevent your pain. Root canals can make you sick. No, that is just the opposite, as that makes your tooth healthy again. Root canals require multiple long appointments. As most commonly seen these days, root canals can be done in a single sitting. Yes, like you have to come in a day and get it done if you don't have a long standing infection. It's better to pull your tooth than get a root canal treatment done. No, that is completely wrong. Nothing, whatever you do, can never replace your original tooth. So that's why it's always better to protect your original tooth. I don't need a root canal because I don't have a toothache. In the long standing infections, you will never know when you have an infected tooth. There might be decay, but you will not have a toothache. That doesn't mean that you don't need a treatment. Further on, in few days, you will see that you will develop a swelling or a pus collection. So that is why you might need a root canal treatment done. Once my root canal is done, my tooth is fixed. Not always. You need to get it restored to its original structure or get a crown done. So these, I hope, most of the myths of the root canal treatment I've covered. Thank you so much. If you have any questions, we will take it further. Thank you so much, ma'am.
Thank you, Dr. Chuhi. After listening to all the three presentations, I was just thinking, just a very general question. Is it possible for anybody to lead a caries-free life? Or everybody in our lifetime, we will all get our cavities and caries, no matter, how we brush our teeth and no matter how much prevention we take. Is it possible really to have a caries-free?
No, it is definitely possible. Like we have seen 80, 85-year-old, they have a full complete set of teeth without any caries. But definitely in that age, because of other systemic diseases, there will be gum diseases or any periodontal diseases. It totally depends on how your teeth are well aligned, how you are maintaining, what food you are eating. The more junk food and more this thing you are eating, there is a risk for caries.
Is there a way to say what is the, like when you define a healthy tooth, what is the average age of a healthy tooth?
They say 100 years.
They say 100 years.
100 years.
Okay.
Because
Sorry, please.
the teeth and bones goes with you. So that's the thing. Yeah.
Since you began your talk with the point that how there is a lack of awareness and how our insurance policies and even hospital treatments, they do not include oral or dental checkup. So what would you, when listening to you, I was just thinking, like if you could little bit focus on childhood, dental hair care, because if we begin early, perhaps it saves us from a lot of problems.
Yeah,
so which is the which is the right age? The child gets its first tooth maybe, I don't know, at the age of a year or so. So when should we actually begin, even as parents? When should we start taking note of and do the examination?
They generally say when you have a tooth in your mouth, you just consult a dentist whether everything is okay.
But no parent does that.
If you have one single tooth in your mouth, please visit a dentist. That's the common term. Because even a child may having early childhood caries or caries related to bottle feeding or any habit, thumb sucking habit. So all these habits, caries prevention, we can do in a very early stage. That's why the topic, the importance of early dental care.
So when you said that every 6 months an adult should get a dental checkup done, so for a child, what should be done?
Child, it is more important. They should definitely get a checkup done because they are in a growing stage. They have milk tooth, then milk tooth will fall and then a permanent tooth will come. So they have more, important things. Their jaw size, jaw proportions. There are so many things. So for child, it is even more important to get a regular dental checkup. That's what Dr. Sarvapalli has stressed, the importance of early orthodontics.
Yeah, would you like to add anything, Dr. Sarvapalli, on this early detection, especially in children?
Yeah, so early detection starts not only from whatever I have shown. Apart from that, there are a lot of things like thumb sucking, tongue thrusting, and things like that. So the general concept itself is the child will start thumb sucking. That is very, very common. But if the thumb sucking prolongs for more than 4 years to 5 years, then it is highly advisable to seek help. Because once the jaws start to grow, this pressure from your thumb might itself cause your growth of your jaws to move in a different direction. It's like how I am using an appliance, as I've showed you all those things, where we can restrict the jaw growth. This, in turn, a small pressure from the thumb itself can actually help in growing the jaw in a different direction, which is something very, very scary to see about in a grown patient like around 8 years or 9 years, where the growth has to be restricted and we have to control it at an early phase. So early detection, you can actually visit by 4 years for an orthodontic checkup for a regular checking of these mouth breathing and thumb sucking and all those other habits.
Like we very often hear or we say that India is the capital of so many diseases. We talk about diabetes, we talk about hypertension. So, do you also, as dental surgeons, do you also find an increase in dental diseases among Indian population, given our eating, how our eating styles have changed? And you said we should avoid junk food and sugary stuff, but I mean, a large population continues to rejoice in that. So, have you seen increase in dental diseases in Indian population, whether young or adult?
Yes, we have consistently seen increase in the dental this thing, because a lot of things like whatever awareness we are creating today is like has to reach each and everywhere, because a lot of people don't know how to brush or how to maintain a regular oral health care itself. So that's the first line of approach. If the brushing technique and the way they are going to keep their oral hygiene is going to be increased at a very, very young age, 100% we can tell you that the upcoming population will be very much reduced of all these caries and all those periodontal problems and orthodontic problems. And like ma'am said, a lot of root canals has to be done. All those things can be avoided at a very, very good control if all these parameters like awareness to the general public is still lacking. We need a lot of awareness to the public where they should know the basis from the school itself. They should know that brushing and all those things should be done at a very, very younger age, and how to do it and when to do it and what to eat and what not to eat and things like that.
I think schools should also have regular dental camps. I mean, of late, we do hear a lot of eye camps happening, but dental, we don't hear so much. I think I'll start taking questions because we are already past midway. And the very first question perhaps is relevant to you, Dr. Juhi, your presentation on RCT. So somebody wants to know whether we can do a root canal if a tooth is already moving.
If a tooth is moving, there are different stages, grades to which it might be moving. So if there is grade 1, grade 2, and grade 3. Up to grade 2, we can still save it because the periodontium and the supporting structure is still there. If it is grade 3, there is nothing much we can do. So if you come visit early to get a checkup done when it has just started moving, we can definitely save the tooth.
Kaja Nazimuddin is asking, what are the symptoms for gingivitis in the teeth, and explain the safety measures to avoid tartar formation in the teeth. So who would take it?
The main signs and symptoms is bleeding while brushing. This is the first and foremost sign which the patient will notice. So if you are brushing and when you are spitting, if you see bleeding from the gums, so that is the first sign of gingivitis. And the way you can stop is all salt, sugar, and acid. These three things, as Dr. Juhi mentioned, these three things are the most important things you have to limit. All this junk food, if you notice, whether it's a Pepsi, Coke, or everything, it is only sugar or acidic content. Or if it is a junk food like pizza, burgers, everything, it is a lot of salt and all the junk contents. So this definitely they mix with saliva, and then the tartar forms. From as I showed in the presentation, it starts with food debris, then it becomes plaque, then it becomes calculus.
Meenakshi Radhakrishnan wants to know children whose teeth have started falling, should they visit a doctor for a basic checkup?
Dr. Sarva?
Yes, they should go for a regular checkup. As soon as the teeth falls, they need to know whether the underlying teeth is coming in a normal position. For instance, if there's a small milk teeth which is going to fall in the front region, we should be able to know whether the upcoming teeth is in the normal position. If not, what can be done? What are the criteria and what are the ways in which we can help in making them come into normalcy? That's how we have to see. So like they said, if they ask at a very early age, if they come at a very early age as the tooth falls itself, it is very, very easy for the dentist or the orthodontist or anyone to treat it at a very, very easy level. Otherwise, it becomes a tedious task for them to treat it later.
Right. I'm reminded of a couple of actresses who have these extra teeth, and people say it adds to their smile and beauty. So, is it that I wanted to know exactly that it is really imperative to get them removed and check the alignment, or retain it as for the aesthetics of a face?
Yes.
The beauty lies in the eyes of the beholder, like how you're seeing things. If you feel it is unesthetic, if you're surrounding people, they're saying unesthetics, then you have to get it done. If you feel everything is fine, I'm fine with myself, my smile is okay, then at least get a checkup done. I mean, the orthodontist definitely will not force you to go for ortho treatment. He will see what is the disadvantage if you're not getting it.
Yes.
So he
Like
will explain it to you.
disadvantage, I would like to add up to Dr. Surya's comment. So, like he said, yes, it depends upon the person's perception, how they see it. But at the end of the day, like you said, you have an extra teeth which is jutting out on the top and it's in the small. On the bottom, they say it's a lucky teeth and all those things. But mind you, I can pull in Dr. Juhi for a second to know that how much incidence of caries has been seen in that contact between those teeth which is slightly up and those teeth is slightly down. Means that,
Mostly, yes, sir.
so in which 99% of the people will definitely end up in a caries. You are asking, is it for aesthetics? No. Apart from aesthetics, function is most important than aesthetics. So the function will play a great role when the alignment is in a normalcy. If the alignment is not good and if your dirt gets stuck inside, that in turn goes into a cavity only.
Because
Since
it's
you
very
also,
difficult for you to remove the debris from there when it is malaligned. It's very difficult for any person to clean it there. So it's more about function rather than more of aesthetics.
Since we're talking about cleaning also, you also mentioned how we are supposed to brush, advisable is twice a day, and flossing needs to be done. So somebody wants to know whether frequent dental cleaning will increase tooth sensitivity and will it erode the enamel lining? Is that true? Who would like to bust the myth if it is one?
Dr. Juhi.
It does not actually erode the enamel lining. Scaling the regular cleaning, which we advise, it's ultrasonic. So ultrasonic scalers, which we use to clean your tooth surface, it does not erode your tooth. It just, with the vibrations, what it does is removes the plaque and the tartar which gets accumulated on your tooth surface. Because that thing, the tartar, when it is removed immediately, it opens your tooth surface. What some people say that they feel sensitivity. We advise a toothpaste and a mouthwash immediately for that. It does not erode your surface of the tooth. It is the healthy way, because if you don't remove that, it will result in your gums receding downwards, which will further cause more sensitivity rather than getting it removed.
Dr. Sarvapalli, what is the normal duration for which a headgear should be worn?
So headgear, as we discussed in the slides, so it's to restrict the growth of the jaw. So it requires at least a minimal duration of 12 to 14 hours a day to wear it in a proper manner so that the jaw's growth can be restricted or can be pushed back into the different region.
Dr. Juhi, should we do root canal on milk teeth? Because as they are anyway going to fall. Mr. John Paul
This
is
is one of
asking.
the most common thing which people think is that it's just a milk tooth. So why should we get a root canal or a restoration done? It will fall off. But there is a specific duration for all your teeth to fall off. Before that, if it falls off, sometimes it results in collapsing of your jaw. What will happen further? Your permanent tooth will not be aligned properly, which will affect your tooth function. So we try and protect that space also if your milk teeth falls before that specific time. So definitely you should get a root canal done for milk teeth to protect that.
A lot of these toothpaste producing companies, they claim they have salt in their paste, they have some charcoal or some glistening thing which will make your teeth white in 6 weeks or whatever. So should people really fall for these gimmicks? I mean, are they gimmicks, and what should people do? Should they use them or not?
Half of them are actually gimmicks, like using a charcoal or tooth whitening and all that. Like people think to believe that it's okay, like we should get it done and all that. But normal toothpaste, as
Is
long
enough.
as it is not,
Mm.
yeah, as long as it is not Ayurvedic thing or a powder thing, it's you are good to go.
Mhm. Are mouthwash like Listerine and in that genre, are they safe to use? Can we use those instead of toothpaste?
Not entirely. It's a supplement with the toothpaste. You can't just use a mouthwash to clean your tooth surface.
Mhm. We'll again come back to you, Dr. Sarvapalli, though you explained a bit, but then according to you, what is the right time to visit an orthodontist? I mean, how will a patient himself or herself realize?
So basically, it's the age where your milk teeth and your permanent teeth are present at the same time. So it's close to around 6 years. So when your first milk teeth fall, so it's better to visit your orthodontist to see whether there are any other things associated with your oral and your bone. That is your maxilla and mandible. That is your upper jaw and the lower jaw. Are there any deformities or anything can be done or anything should be stopped? So that's the right age. If at all the patients are having mouth breathing and thumb sucking habits, it is advisable to visit earlier at 5 years or 4.5 years to just to get know whether it's okay or it's not okay to withdraw that habit.
You've already partially addressed the issue, but like as you mentioned also, that people tend to postpone their visit to a dentist. It is either out of fear or for the cost factor. And whenever there's a toothache, the normal tendency is to go for home remedies, put a glove, massage with some tree oil. I've known people doing it with mustard oil and a pinch of salt. A lot of these home remedies which have been passed down generations also, and people seem to be having a lot of faith. So you think, does that really help? Or even if it helps 1%, how long should a patient, keep on doing? Because, sometimes what happens, the pain suddenly goes. And then the patient also forgets. But in the meanwhile, the tooth may be getting more and more decayed and damaged. And then again, it resurfaces. So what would you advise, from the start of the first pain to whenever, or even a patient may not be in a position to go to a doctor immediately?
I think you can do it as a temporary measure, but that is not a permanent solution. Once the cavity is formed, whether you put clove oil or any mustard oil, it's not going to clean the cavity and restore it. So what dentists do is they clean the infection, they clean the dental caries, and they fill it and they bring the tooth back to the normal function. So it is not only just reducing the pain. So our main target is not only pain control. We are controlling the pain, we are removing the infection, and we are restoring the teeth back to its normal function. So that's why these things are important. The home remedies, maybe you can use it as a temporary measure.
Stopgap.
Yeah.
So you also talked in detail about brushing, so Mr. John Paul wants to know what is the ideal type of brush for both kids and adults, and what is the ideal time duration of brushing. There are a lot of people who choose to brush only in the night. There are some people who choose before every meal. Some choose after every meal. So is there any, would you suggest any proper standard routine which will more or less keep you safe, keep the teeth safe?
See, you would have seen that picture in the presentation. I showed you the brush in a particular direction. For lower teeth, it is like strokes from down to up. So generally we say 2 to 3 strokes per segment. So that is the direction of the toothbrush. So it might take up to 2 to 3 minutes for a proper brushing. And generally, coming to the toothpaste, there are some medicated toothpaste and there are non-medicated toothpaste. So for example, if the patient is having sensitivity or any severe attrition, erosion, all these things, then we advise medicated toothpaste which has a good amount of fluoride content or some other content which reduces the sensitivity. And coming to the toothbrush, generally we do not prescribe hard toothbrush. The hard is out of a suggestion. Generally, we suggest for soft brush and proper brushing technique. This will help.
And how often should people change the toothbrush?
Generally, we say once in 3 months. Once the bristles of the toothbrush, you see it is spread and it is totally worn, then this toothbrush is not going to give you an efficient cleaning. It is time to throw and bite in you. So with the when you see the bristles, you should understand that okay, this is the time to change it.
Dr. Sarvapalli Meenakshi Radhakrishnan wants to know, is flossing necessary if there are no visible particles stuck in the teeth?
Yes, 100% yes. Flossing is mandatory. So, for instance, you eat something and then you go and brush it. So, what happens is that each and every tooth is adjoined by structures, like they have a contact point and a contact area. So, what happens when the food gets lodged in between? Whatever you brush it, however you brush it, you can clean on the top surfaces as well as on the bottom surfaces. But those particles which are stuck in between the teeth, you might not be able to see in your naked eye. But if you do a proper flossing, you'll be shocked to see that there are so much debris which you are able to remove from the floss after the meal, even after brushing. You can give it a try and see, so that you will be surprised to see how much amount of dirt you'll be able to remove even after a good brushing.
Many parents give pacifiers to babies. Do those affect their teeth?
Pacifiers don't affect much unless and until if it's prolonged for a very long duration. So it's like for 1 hour, 1.5 hours, it's fine. But some people are there, they are used to give pacifiers for a very long time. So I would not recommend to give it for a very long time, since it affects not only that, the entire oral care is also demolished because of that. And apart from that, your jaws and other structures also will start to move in a different direction apart.
Could one of you also throw light on women like who are going into perimenopause or menopausal women? Do they need to take any special care, because as it is, there is calcium deficiency, and because a lot of women also complain about gaps in between their teeth. So is it in some way connected? Could you throw a little bit of light on what happens when a woman goes into menopause? Does it affect their teeth health?
See, post-menopause, there is a direct correlation with periodontal disease because of the hormonal changes and increasing age. So the healing of the periodontium will be delayed, and there is a high chances of gum diseases post-menopausal. So definitely you need to take extra care regarding this.
Dr. Juhi Anand, of course, as a doctor, you would like to save a patient's tooth. But many times the patients are so fed up. And sometimes also what happens is, even in an RC tooth, the infection comes back. So many times the patient themselves insists, no, please extract my tooth. I don't want it. So what do you do in that situation? I mean, what is advisable? Do you really, and does tooth extraction really affect in some way your health or alignment, whatever?
Like, we give the patient the option, ma'am, like what are the benefits of getting the root canal done or trying to save your own tooth rather than getting it extracted. But if the patient is hell-bent that they really want to remove it and they are just fed up, we don't have an option. We have to comply with the patient, but we need to educate them what are the pros of saving it. If they remove it, what happens in your occlusion? The upper and the lower teeth, they come together and they are aligned this way. So if the lower tooth is removed, what will happen? There is no opposing structure. So this will slowly supra erupt, like it will keep coming down, and your alignment will go off. The space which is there, the adjacent teeth, it will try and take that space. So there will be tilt in your teeth which are there other. So it will affect a lot of functions. In case of extraction also, we tell them to get it replaced. That is the other option which they can get it done.
Right. So I'll just go back for one quick round of say messages or reiterating the importance from each of you, like because we began with the point that there's lack of awareness and at three levels, the hospitals, insurance companies, and the patients themselves. So how do we really integrate oral hygiene? Because it is something which we all take for granted, So, how do we really integrate the message of importance of oral hygiene in our overall healthcare system, in our overall healthcare?
I think our state government and central government should include this oral health checkups included, and they should conduct various oral health awareness program, especially in the village side and in the town side, in the schools, in various places, so that the people get aware of the dental care.
Would you like to add anything, Dr. Sarvapalli?
Yeah, the same thing what Dr. Surya said. Apart from that, if they give some new policies, because dental treatment is kind of expensive because of the raw materials which we procure from, because most of the materials which we procure from are either made outside India, which are quite expensive. Because to procure that itself, it is an expense. So on the top of it, all the other taxes and all those things together, it becomes an expense on the patient's head. So if they have a plan on a health policy where they can cut down their expense to a moderate level, I think most of the healthcare people will be happy about treating their patients, and a lot of patients will also be benefited from that. So the government maybe should take a policy or something like that to endorse in the coming days to make sure it happens.
Dr. Juhi, would you like to?
Plus the insurance part, ma'am, it's also about the mindset. Like if we have a coverage for a specific kind of treatment, like in general health itself, people get it done because they have the coverage from insurance. If this is also included in that, in a way, it will motivate them to get a treatment done.
Okay, I think we have really crossed our time limit. But there was one, I don't know whether it was meant to be a serious question or humor. Mr. Magesh S was inquiring what happens in animals. Do they encounter dental problems?
Don't know.
Yeah, there have been instances of getting root canal treatment done in animals also. It's more of a thing that they can't convey it to us, like us humans, but yeah, they go through pain as well.
Okay.
You do have dental problems for sure, because I take my pet to the vet.
Pet, yeah.
They have a lot of dental problems. Yeah, I can see they use all those treatments to enhance it.
Right. Okay. So thank you so much, Dr. Sharma, Dr. Sarvapalli, and Dr. Juhi Anand for sparing your time on Sunday and giving us all these wonderful inputs, and also to the audience who sent in their questions to make it a lively discussion. And I thank you all for tuning in for this edition of the webinar on the early importance of early dental care under the Hindu Wellness series brought to you by Naruvi Hospitals. Thank you so much.
Can we leave? Nicely presented, both of you. Congratulations.
Congrats, Doc. Congrats, both of you.
Congratulations.
All right. See you.
Okay, bye, sir.
Bye-bye.